Hey everyone, good day to all. Myself, Dr. AJ Moria. Today I'm going to discuss you guys about some of the most important ophthalmology images for the Fmge examination. Okay, for the PDF guys, the link in the description, Telegram. And also you can just type the Fmge aspirants Dr. AJ in the Telegram. There is a group. Okay, you can join there. Okay, the first one is guys. The first one is guys. You have to know about the types of cataract. Types of cataract. Okay, na. So first one is the snowflake cataract. Snowflake cataract. Snowflake cataract is seen. Snowflake cataract is seen in diabetes mellitus. In diabetes patients, see the snowflake cataract. Next is the rosette cataract. Rosette cataract is in the rosette blunt. Okay, seen in the blunt cataract. Okay, seen in the blunt trauma. Next is the sunflower cataract seen in the Wilson disease and the penetrating trauma. Okay, penetrating trauma. Next one is the Christmas tree cataract. Christmas tree cataract seen in the myotonic dystrophy. Myotonic dystrophy. Next one is the shield cataract. Shield cataract seen in the atopic dermatitis. Atopic dermatitis. Okay. There is the blue dot cataract is the most common congenital, usually insignificant. Okay, seen in the is the blue dot cataract. Okay, blue dot cataract. So guys, from these types of cataracts, from this cataract, we will get one MCQ. Okay, na? 1 minute. Okay, you will get one. You will get one MCQ. Okay, from this cataract, you will get one MCQ. Okay, the next one is this one, guys. Okay, now this is types of conjunctivitis. The first one is, guys, it is the giant papillary conjunctivitis. See, we will see this one. For this, guys, they will give the history of there is something. There is a patient is using the contact lenses. Okay, na itchy, redness. Okay, na. So, guys, here this will be the giant papillary conjunctivitis. From this, okay, now then the drug of choice is the olopadadin. The next one is this is the VKC, vernal keratoconjunctivitis. Vernal keratoconjunctivitis. For these guys, they will give the history of is the also called as spring cataract. It usually occurs in the more in the summer season. They will also give this one. Okay, now there is a cobblestone appearance. Okay, and also the history will be the boy only. Okay, na. So this one. Yeah. Please remember that there they will give the history of contact lenses. Here they will give the history of spring cataract while the more in summer. The next one is the flectanular conjunctivitis. Okay, na. There is a yellowish nodule. There is a yellowish nodule at the limbs. Okay. So this is the type of hypersensitivity. Okay, now from this image, guys, will get one MCQ. The next one is the defects in mirror. Okay, the first one is the myopia, hypermetropia, astigmatism. Okay, you can see this one, guys. Myopia is also called as nearsightedness. Okay, now see what happened here is you can see here all the light rays falls in front of the retina. All the light rays fall in front of the retina. And also, guys, there is a history of the history says that a patient is squeezes the eye. Squeezes the eye to see the objects. That is to see the objects. Okay, na? And also, guys, you have to correct the myopia by using concave lens. Using the concave lenses. Okay, na? Remember the image and the correction history. Okay, done. Next one is the hypermetropia. Hypermetropia also called as far sightedness. Okay, now you see here what happens here. The light falls behind the retina. Light falls behind the retina. Behind the retina. Okay, now so what is the correction you will do that by using convex lenses. Okay, now this is the plus lenses. Okay, this is plus lenses. Okay, this is a minus lens, this is plus lenses, and also they will give there is a asthenopia, rubbing of the eyes, rubbing of the eyes like this. Ah, rubbing eyes to see it called as a asthenopia. Okay, now there is a astigmatism. What happens here? There is a multiple lights will fall at one side. Okay, multiple lights will fall at the one side. Multiple lights. So we have the types of the astigmatism. Just review it later. Okay, the correction is called as the correction we will do as by using toric or cylindrical lenses. Toric or cylindrical lenses. Okay. Next one is, guys, I think everyone knows this one. Retinoblastoma. Retinoblastoma. Leukocoria is the most common manifestation, and there is a chromosome called as 13q and 14 gene, RB gene, Knudsen 2 hit hypothesis. It's okay, describing this retinoblastoma. Most common is the leukocoria. There is a chemotherapy called as VEC. VEC is the vincristine, etoposide, and a carboplatin, not the cisplatin. Not the cisplatin, is the carboplatin. Please remember this one. We'll see the flexor intestine body. Flexor intestine rosette shape. Okay. On the histopathology. We can see here this is the congenital glaucoma. Congenital glaucoma called as Ophthalmos. They will give this image. There is an image with the blepharospasm, photophobia, and there is a history of the lacrimation. Okay, now surgery for the with congenital glaucoma with the clear cornea, you will do the goniotomy. For the hazy cornea, we do the trabeculotomy. Okay. Just remember the image and the history. Okay. Next one is the guys for the foreign bodies. So guys, for the see, remember everything. Remember one thing, guys. For the deep foreign bodies should not be removed. Should be removed on OT only. If you have something, the eyes like this one metal, please do not remove here. Okay, na? You have to go to the hospital. It must be removed on the OT only because due to high chances of the what bleeding. Okay, now that's why as MRI is contraindicated. Okay, CT scan can do, but MRI is contraindicated. Have to remember. That's why retain intraocular foreign bodies such as example iron. It causes cirrhosis. Cirrhosis bulbi, iron deposits in the cornea, lens, iris, and the retina. Okay, can lead to retinal degeneration, and also copper. If it is copper, it called as a chalcosis. There is a carefree and a sunflower cataract. So guys, always remember the alkali is the most dangerous one. Example lime. Okay, most dangerous. See, management, you have to always do the copious irrigation with the ringal lactate or saline till pH becomes neutral. pH become neutral. This is the question they asked in the last exam also. Okay, and this is also the one. This is also the question. Please remember. Okay. Next one is the types of keratitis. Types of keratitis. You have to remember the viral, bacterial, fungal, acanthamoeba. Okay, now remember how. Let's see how to remember. These are the dendritic. These are the dendritic. These are the what? These are the arborizing pattern. Having that, they are having the terminal bulbs. They are having the terminal bulbs. Okay, like these bulbs. Okay, so this is called by the HSV. Okay, now always the history will share the reduced corneal sensation. They'll give this diagram. How to remember the viral infection, viral keratitis. Okay, now coming to the bacterial. Bacterial gives the greenish. This is the greenish one. Is greenish. Okay, now in India it is most common caused by the pneumococcus. In the worldwide it is the Staph aureus. Green color. There is a wet infiltrated ulcer margin defined, and there is hypopyon is sterile. Mobile here. Remember the bacterial. From the fungal, guys, this is the satellite. This is the satellite lesion. This is the satellite lesion. The most common cause is the filamentous fungi. In the immunocompromised patient, the most common cause is the candida. Candida. They always give the history of the farmer. Okay, with trauma with the vegetable leaf. Okay, like, okay. Treatment is a 5% atomization. Okay. Acanthamoeba, guys, you can see here, this will be the ring formation, okay, na? The ring shaped ulcer. This is a ring shaped ulcer, okay, na? You have to remember this one, guys. There is contact lenses, poor hygienic, okay? This is the acanthamoeba, okay, na? Next one is the, guys, these are the images. Let's see this one. These are the images, guys. Okay, wait. Okay, you can, this is the D shape. This is the iridodialysis. The iridodialysis. It's the iridodialysis. This is the chalagen. Chalagen is painful or painless? It is the painless. Chalagen is a painless. Sty. Sty is very painful. Okay, na? This is the ophthalmia neonatal. Okay, na? I will talk about this one. This is the trachoma. Okay, na? This is the what? This is the tonometer for pressure. Okay, intraocular pressure. This is the list nodule of the NF1. Okay, these are the NIS nodules. Okay, now this is the optic nerve glaucoma. These are the DCR punch. This is the chalagen clamp. Chalagen clamps. Chalagen's clamp. Okay, now this is the what? I think everyone knows this is the retinitis pigmentosa. Retinitis pigmentosa. Please remember, guys, this is very important. Retinitis pigmentosa. This is the CRVO tomato flesh appearance. Okay, now this is the CRO. Okay, cherry spot. Okay, this is the NPR non-proliferative. Okay, na? This is non-proliferative. This is the proliferative retinitis. This is the pterygium, guys. Okay, you have to remember this is pterygium. I will discuss this also. This is the limbal desmoid. This is the foreign body. This is the KF ring seen in the Wilson disease. This is the Chagas. This is Marcus gun appearance. Okay, na? This is the acanthamoeba. This everyone knows. This is the Sherman test to the dryness, orbital cellulitis. This one. This is the. This was what? Thyroid eye. Okay, na? Remember this one, guys. So we can do this. This is the case of the conjunctivitis. This is the subconjunctival hemorrhage. Blunt trauma, most common causes. This is the congenital cataract. This is the leukocoria. Do not everyone knows. This is jonular. Okay. Next one is the this one. Angular conjunctivitis caused by Moraxella Anxelfeld. Okay. Tetracycline is the zinc is the drug of choice. Okay. Na? This is art lines here. This is the art lines here. This is the conjunctivitis scaring. Okay. I think everyone knows about this one. This is the Isiara chart for the screening of a color blindness. This one, guys, everyone, this is Snellen chart. This is the Landau E chart. Okay. Just remember the trachoma. Trachoma is one. So, guys, trachoma, this is most called by chlamydia trachomatis A, B, B, A, C. Okay. You can see the alternate here. The herpes Pits. This is the sago grains. You'll see the sago grains follicles appear in the upper tarsal conjunctivitis, herpes follicles on the limbus. Okay, now for this, guys, you have to remember the trachoma is safe criteria. Criteria is the you do the surgery for advanced diseases, antibiotics to clear trachomatis infection. What are the antibiotics you have to use? You have to use the azithromycin. Facial cleanliness, E means environmental improvement to reduce the transmission. You are the for the trachoma, guys. Okay, now next one is this is the indirect ophthalmoscopy. It is the real inverted images by binocular stereoscope view. Okay, this is the indirect. This is the direct one. Okay, now please remember the image also. EGTR's chart. You can early treatment diabetic retinopathy study. Okay, this one. This is the guys ophthalmia neonatal. I told about this one. This is the conjunctivitis in a neonate within 22 days, 28 days. Okay, now if it is within 1 hour, it is means it is due to the use of the silver nitrate. Silver nitrate. If it was within the 1 to 4 days, it is the gonococcal. Okay, now most common cause, most dangerous can lead to cause corneal ulceration. Within the 5 to 14 days, it is the chlamydia. Okay, now staphylococcus after 1 week, herpes simplex after 1 to 2 weeks. Okay, now prophylaxis will the iodine or tetracycline or erythromycin ointment. Okay, next one guys, the ophthalmia types 1. Okay, ophthalmia types. See, X is a night blindness. X1A is the conjunctival cirrhosis. Please remember here that what is the first sign? What is the first sign? First sign of a vitamin A, vitamin A deficiency is the conjunctival cirrhosis. First symptom is the night blindness. Okay, you got to remember this one. Next one is the pterygium. So guys, you have to differentiate between the pterygium and the Penangocula. Penangocula are yellowish in color. See, yellowish in color. These are the fleshy color. This is fleshy. See here. Please remember this one. See, you may get the image of the Penangocula or pterygium. You have to do, but mostly you have to get the picture of the pterygium. Okay, now pterygium or the body, neck, and head. Okay, now. Okay, now there is a accident. Okay, now so you have to remember this is the pterygium, guys. So what is the treatment they are asking? It is the accident with conjunctival autograft, use of the mitomycin. Okay, now also the amniotic membrane graft. It is associated with the astigmatism. Remember this one. Next one is the guys this is strabismus. This is the ocular misalignment. Okay, na ocular misalignment. Okay, see here, guys. We have different types. This is the esotropia. See esotropia. If you see esotropia, like this thing. But see here, guys, what happens? One eye is coming this side to the ear, but one is remains at the one side. See here, one eye is remains this side, but this is not coming to this side. It means the esotropia. This is exotropia, outside, outward. Eso inward, extra means outside, outward. See, one eye is remain one eye is normal, but this eye remains here only. Okay, it's exotropia. Hypertropia. Okay, one eye is going to upside, but one is remains here only. Hypertropia. This is also the hypertropia. Okay. Okay, now this one is the entropion. Okay, entropia, inward turning of the eyelid. This is the ectoperion. This is the Horner syndrome, guys. You have to remember the myotosis, meiosis, and the apparent and ophthalmos. Okay, and ophthalmos. Okay. The next one, guys, this is the extraocular muscles actions. You have to remember the okay, na? This is the middle rectus, lateral rectus, superior rectus, superior oblique, inferior obliques, guys. You have to remember the what is the primary actions they may give in the exam. Okay, now yeah, they will give in the exam. You have the tip to remember the see all obliques are supplied by the abductor muscles. Okay, now all obliques function as the they are abductors. They are abductors. All ductors except the lateral ductors, it is all are adductor. Okay, now please remember this one. I don't know how you are going to remember, but please remember this, guys. Okay, now from these guys, there are going to be the 1 or 2 MCQs. And also please remember this one is the visual field defects. Okay, now they will give the a big history. They will give the big history that and also they are going to give these diagrams, guys. Okay, now these diagrams. So you have to remember, you have to mark the answers. Okay, now for the optic nerve is the I think we know that we are having temporal and the we are having the temporal and the nasal fibers. We are having the temporal and the we are having the temporal and the nasal fibers. Okay, you see here. See here. This is for the optic nerve, guys. This is the right side. This is the right eye. This is the left eye. Okay, now total blindness on side lesion with the normal vision on the other side. Okay, now for one side is a total blindness on eye, other side is normal. This is the optic nerve. You'll get this one images. Okay, now example trauma. Okay, now tumors and the optic neuritis. Okay, now these are the And this one, if you got this image, guys, this one, guys, this is the bilateral nasal fibers. Bilateral nasal fibers. Okay. Bilateral nasal fibers are remains normal, and the temporals are get affected. So this is the seen in the this is the bitemporal heminopia. Okay, this is the other heteronomous. Okay, now example here is seen in the pituitary lesions like craniopharyngioma and the adenoma, guys. Okay, now please remember like this one. Okay, just remember the images. Okay, now this is the macular sparing. This is the macular sparing. contralateral contralateral inferior corneopia. Please just by heart the image. Okay, by heart the image. Okay, okay na? contralateral inferior corneopia. Okay na? Just guys, please remember the by heart the images and the conditions. Okay na? The next one is the this is the toxoplasma gondii. Okay, the toxoplasma gondii headlight in fog appearance. Okay na? This is punched out in macula. Okay, this is the guys. This is the CMV retinitis. This is the pizza appearance, guys. This is the pizza appearance. Okay, this is the gancyclovir. This is the guys keratoconus. Everyone knows this one, I think. Keratoconus is a gonioscopy. This is the Perkin tonometer. And the important one is what this is the Goldman application. This is the gold standard one. Okay, na? This is the Goldman, which is the gold. They will ask which is the gold standard, but it means they're asking the Goldman application. Okay, na? Sometimes they will not give the name as the Goldman. They just give the appellation. Okay. The next one is, guys, this is the Munson sign. Next one, guys. I think I discussed about this one. This is the incident. This is Chalajan, INC, Entropium. Okay, Chalajan done. This is this guy. Trachiasis. This is the dischiasis. Trachiasis. What? Okay. Trachiasis. This is the dischiasis. You see clearly here. Oh my God, what happened here? Next one is the this is Chalajan clamp. This is the internal heart volume. Ectropion done. Basal cell carcinoma. This one. Most common location is the lower lid. Okay, near the canthus. This one, guys, this is the iris nodule. Iris nodules we have in the Kupes and the Boscaras nodules. Okay, in the iris. This is the Buccas nodule. This is the Corpus nodule. You have to see this one. The band shape. This is the band shape keratopathy seen in the hypercalcemia, uveitis, corneal ulcer. Okay, na? Remember this one. This is the last one is the nasolacrimal duct obstruction. This is the failure of the canalization of the nasolacrimal duct by the end of the gestation, guys. The most common set is the valve of Henner. First of all, guys, till 9 months you have to do the you have to do the Krigler massage. 9 to 4 years you have to do the syringing and the probing, and then after 4 years, guys, you have to do the DCR. Okay, rhinostomy, guys. Okay, na? I think, guys, these are the more than enough. I'm sure that you will get at least 2 to 3 images from this one in the ophthalmology, guys. Okay, thank you very much. See you soon.